Hey, what's up, guys? It's Dave, and today we're going to talk about our tiered response, our tiered disposition tool here for currently we're using this with Blacksburg Volunteer Rescue Squad here in Southwest Virginia, and a lot of other agencies in our region are also sharing this tool. That said, keep in mind things do update and change regularly, so if you are watching this any date past the 23rd, then I highly recommend that you check for the current version of this. You can go to bit.ly/COVIDEMS, or you can hold your camera phone up to the QR code right there in the top right corner, and that's going to open up the most current version of this for you. All right, so the way we are following things here, we have this tiered response plan, and this is really talking about who's getting transported and where and why and how that whole thing works. All right, so tier one is our average demand situation. So this is just our standard consent or patient refusal. This is what we're going to do most of the time, no matter what's going on. This is for if we have any patient and we aren't 100% sure what's going on, we're still recommending that they go get transported to the hospital and get checked. We are in this current situation, this COVID-19 pandemic, we are discouraging visitors. It just puts them at extra risk. And actually right now for us locally, all of the hospitals that we transport to actually have shifted to kind of a no visitor, very limited visitor policy. So there are some exceptions to that depending on the situation, but in general, they are definitely discouraging visitors or people riding with us or showing up at the hospital. So the best thing to do is just to inform the family of what's going on with the hospital. Make sure that they have a phone or a way of getting in touch with this person, and when they're getting discharged or have updates, the hospital or the patient can contact them and either give them updates or get them a ride arranged. So maybe just get their contact info and pass that along to the hospital is probably your best bet. And as far as documentation, so we're just going to do a standard refusal form if the patient chooses not to go to the hospital. So at this point, we're still recommending that they go get checked. We go through all the standard refusal stuff. And if they don't want to go, we do a normal patient care refusal on our EPCR. All right, then moving on to tier two. So this is this increased demand where we're calling this like an informed refusal. Basically, depending on what's wrong with the patient, if they have just a really mild or minor complaint or injury that really does not indicate that they should be going to the hospital in the first place, where under normal circumstances, we wouldn't really tell them that. We would just, if they feel like they want to go to the hospital, okay, cool, we will take you. Now, we're kind of balancing the risk of them not going to the hospital because of their minor injury or illness with the risk of them going to the hospital with the current pandemic situation, right? So where normally there's not really any risk in them going to the hospital, so we're okay with them going regardless. Now we're in the situation where we're really having to balance the risks and benefits on both sides. So there are some potential risk for them not going to the hospital and getting treatment or getting assessed by a physician for these minor things. But at the same time, there's also risk of them going there. For one, the hospital system may be taxed on resources and supplies, and they may wind up waiting for a while. They might be going and being exposed to other patients at that hospital that have other situations, and they might be taking some of those limited resources away from someone who's really having a life or death emergency. So in this situation, we're not telling them that we're not going to take them, and we will still take anyone that wants to go to the hospital, but we are making sure that they are making an informed decision about that. Whether or not they choose to go to the hospital or not is still up to them, but we are making sure that they fully understand the implications of that, both in the positive and negative way, so that they can make an informed decision if they want to go to the hospital or not. Now, we really use caution with this anytime that there's somebody that's, at a really high risk, or it's not a mild or minor complaint, or that they have other high risk factors. We still want to get them checked and we want them to go to the hospital. So this is not by any means discouraging people that need to go to the hospital away from that. All right, this is saying the people that really probably don't need to go to the hospital probably shouldn't, and so we want to make sure that they are aware of that, and so that way they can make an informed decision. So if they choose to not go to the hospital, then what we're going to do, we'll still, on the EMS side, we're still doing our standard paperwork. They're going to sign all the documentation. We're going to talk about the risks, the benefits, all that. But now we're also going to provide them this regional home care guide, and we will go through that here in a little bit. But basically that just gives them some information and some contact information if they want to follow up with that. It allows them to kind of track their own symptoms. Really, this is kind of geared more towards the COVID-19. So that's kind of really the intent of this document, but it can be useful for other things as well. But that just allows them to track themselves and their condition and see what needs to be done. So check out that document there, and we will talk about that here in a little bit. And then finally, the transport, if we wind up transporting them, again, this is where ultimately if they want to be transported, we are still going to, even if it is something that's minor. We just want to make sure that they really understand the implications of that. So if there's any concerns, or if the patient does not want to refuse and wants to go to the hospital, then we will still take them to the hospital. All right, then in Tier 3, this is a sustained demand. So this is basically like system overwhelm. There's just not enough ambulances out there, not enough resources, not enough whatever, that really taking somebody to the hospital that has a very mild or minor complaint or condition is actually putting them at more risk than they are currently by staying home. And so while this kind of may come off, if you're not familiar with this stuff, as a little weird because it's so far outside of our norm, normally there is no risk when we take someone to the hospital, or extremely small risk. And now we're saying that in this situation, that may be different. And if taking them to the hospital is going to be more risk to them and to the community, because it's not, it's using limited resources and taking your ambulance out of service, and it's bringing them to a place where they could be exposed to other patients who actually are infectious or who are having serious medical issues, that's going to be potentially more risk to them. So we want to balance those things. And, basically at this point, if we encounter somebody who's got a really mild or minor complaint, we're going to talk to them about it, kind of go through if they want to refuse treatment like our normal conditions, like a lot of the calls we run wind up being refusals anyway, then that's fine. We just treat that as is. But if they want to refuse or stay home, great. If it's COVID-19 related, but their symptoms are mild and not concerning, we can still provide them this home care guide, and that's going to help them kind of track their own condition, and it's going to give them information in when they may want to follow up, when they may want to go to the hospital, what to do to keep themselves and others protected, all of those things. So check out that document, and that'll help. But the last line on here is kind of where it's a little bit different. So if the patient really demands to go to the hospital, they want to go to the hospital and they feel that it is necessary. However, they do not have an emergency condition, and there is, nothing significantly wrong with them that would necessitate them going to the hospital. This last tier gives us an option to call medical control. And ultimately, if we talk with the ER physicians or with our online medical control, and they agree that this situation is not appropriate to transport to the hospital, and it would put the patient and the community at more risk, then they may go ahead and tell us not to take that person to the hospital. Now, if that is the case, obviously we still want to provide them with all of the information and resources that they need. We want to educate and inform them so that they do know what to do. So we're not just leaving them out to dry. We're just providing them with the appropriate resources, which in this case is to actually stay at home and isolate versus going to the hospital. So there are some conditions with that. So we're going to scroll down here and look at those real quick. This is all geared really towards the COVID-19. So if someone has minor symptoms, so like they have a mild fever, they, otherwise their vitals are stable, they don't really have any other risk factors, then yeah, we're going to follow this tiered disposition. And depending on where we're at in that system, we may just recommend that they go in tier 1. We may educate them in tier 2 and let them make an informed decision themselves, but make sure that they understand that, it may not be the best idea for them to go and that they understand those risks. And then finally in tier 3, if it's minor, we may wind up talking with the doctor on the phone and letting the doctor and the EMS crew determine whether or not it's appropriate for that person to be transported at this time. And if not, then we're providing them with the information that they need. With the COVID severity, if it is a major concern, so any of these COVID risk factors, so they're over 60 years old, they're diabetic, pregnant, heart disease, lung or kidney disease, immunocompromised, or anything else that in your provider impression or in your medical judgment puts them at a higher risk, then they should be transported. As far as some exam risks, so like things that we're going to assess, obviously we want to check their vitals. If their pulse is over 110, respiration's over 22, if their temp is 101 or greater, and I'm sorry, when I was saying those before, so the pulse is 110 or greater, the respirations are 22 or greater, temps 101 or greater, their SpO2 is less than 95% on room air, their systolic BP is less than 100, or if they are acutely altered with level of consciousness. So if they're in a nursing home and they have dementia and they're always altered, that's a little different. But if it's a new thing, then we're concerned that that could be related. So we definitely want to transport anybody meeting any of those risk factors or anything in your clinical judgment that puts them at a higher risk that you feel that they need to be transported, then you should. And with this tiered disposition, this is something that you can consider for any complaints, not just COVID. So the risk factors here that are listed, obviously those are COVID-19 specific. However, if you are called to the scene for someone that has a paper cut, you can, talk to them about it, help them out, help them wash it, put a Band-Aid on it. But ultimately that person probably doesn't need to want to go to the ER, and it's probably not safe or smart for them to go to the ER. So if we took them, that's putting them at risk. That's creating a lot of cost for them. That's putting an extra burden on the healthcare system, and it's taking your ambulance out of service, where really we don't want that person at the hospital. We just want to teach them what the appropriate care is for that paper cut. So it doesn't have to be COVID related. We still kind of want to follow that same tiered disposition. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.